This is a delayed press conference because it was supposed to have happened in Addis Ababa during the African Union annual summit. But unfortunately, due to unforeseen circumstances and the loss of our second president, we were unable to travel. And I want to begin by thanking our partners, all our partners, and especially the Alma fraternity, whose chair I assume, for not being able to have attended the handover ceremony. But all the same, as the incoming chair of the Africa Leaders Malaria Alliance, I'm very pleased that I am assuming this leadership role for an organization that has had over the years a very strong advocacy and is on the front line of advocating, ensuring accountability, clear action plans, and has also been involved in resource mobilization to combat malaria across the African continent. I do believe that with accelerated action and new models to deal with the disease, we can meet the bold and ambitious targets set in the catalytic framework to end AIDS, TB, and to eliminate malaria in Africa by the year 2030. I want to, at this stage, take this opportunity to congratulate the outgoing chair, His Majesty King Mswati III of the Kingdom of Eswatini, for the unparalleled leadership that he has shown during his time at the helm. His Majesty kept malaria high on the political and development agenda, and by the end of 2019, 12 countries on the African continent had launched the African Union Zero Malaria Starts With Me campaign that the King established with distinction. I believe His Majesty established an End Malaria Fund in the Kingdom of Eswatini and presented 2 annual Africa Malaria Progress Reports to the Assembly of the African Union Heads of State and Government, and played an active role in advocating for the full replenishment of the Global Fund to end AIDS, TB, and malaria. However, while significant progress has been made, Africa continues to bear the malaria burden. 93% of global cases, that's about 213 million, and 94% of the global deaths, about 380,000, are on our continent. Accelerated action is therefore needed, particularly in the 10 high-burden AU member states that account for 67% of global malaria cases and 62% of deaths. These are mainly Nigeria, the Democratic Republic of Congo, Uganda, Cote d'Ivoire, Mozambique, Niger, Burkina Faso, Mali, Angola, and Tanzania. As the incoming Alma chair, and in order to maximize impact and to accelerate malaria elimination on our continent, I want to state today that my main focus will be the following key priorities. I want to work with regional economic communities to engage heads of state and government to address key challenges, but also to provide solutions to them. This will include the use of innovation and technology, to introduce sub-regional scorecards for review and action by heads of state and government, to share lessons learned and best practices, and to use awards for excellence at sub-regional level to recognize good performance. To address the resource gap, I will strive to establish at least 15 national end malaria councils and funds to boost high-level multi-sectoral engagement and advocacy and enhance domestic resource mobilization, including from the private sector of the continent. End malaria councils and end malaria funds are very important country-owned mechanisms to enhance county-level prioritization of malaria. I also believe that we need to create an Alma Youth Advisory Group, which I'm calling the Malaria Army, working with existing youth leaders from the various youth structures in Africa to champion political and resource commitments to promote innovation, research, and development, as well as create a cadre of malaria advocates and champions. We also need to support African Union member states to enhance digitization and to use real-time malaria data at various levels. This, I believe, will enhance the sharing and transparency of the country malaria scorecards for accountability and action, and promote African-led malaria research and development, leveraging on existing African research institutions. The aim of this strategy is to ensure that all our citizens in all spheres of life and at all levels are aware of the malaria situation and are also empowered to act. So therefore, ladies and gentlemen, in closing my remarks, I urge all of us to heed our clarion call that zero malaria starts with me. To defeat malaria, we need to ensure that we increase the engagement of women, children, and youth, that we mobilize sufficient funding, including from domestic, public, and private sector, and address the threat of stagnation of donor funding so as to ensure that we fill the current financing gap of around $2.5 to $3 billion annually. We must also address climate change, which is impacting mosquito breeding sites and leading to increased epidemics. We must also increase the use of data and technology to drive impact and change. We too need to address insecticide resistance and the threat of drug resistance, which is also leading to increased costs of new commodities. And lastly, to increase the local manufacturing of malaria commodities in Africa. Currently, local manufacturing capacity is very limited due to lack of active ingredients from the continent, weak procurement and trade policies, and lack of harmonized regulatory regimes.